I'm mindful of the time since we want to leave room for discussion. So good morning, everyone. Welcome to Panel 4, Toward Efficient and Sustainable Delivery of CCAB-Focused Interventions. My name is Eve Reider. I'm in the Prevention Research Branch at the National Institute on Drug Abuse. And I'm very pleased to be moderating this panel today. Delivery of evidence-based prevention on a large scale has required the development of measures to monitor implementation, including selection and adoption of evidence-based programs, training and technical assistance, fidelity monitoring, and other organizational system and user-level factors. Measurement of implementation factors can provide information related to the decision-making process for evidence-based prevention, quality of program or service delivery, sustainability of implementation, and influence of implementation factors on intervention outcomes. In this panel, each presenter will talk about lessons learned and recommendations for moving the field forward, given the need for sustained quality implementation of programs in order to impact CCAB outcomes, all in 15 minutes. I encourage you to look at the presenters' bio sketches because I will not go into great detail, so we'll have more time. Dr. Richard Rico Catalano will provide an overview of the types of measures needed for monitoring implementation of programs at scale throughout the implementation process. His overview will be framed within the context of implementing the Prevention Operating System Communities That Care. Dr. Catalano is the Bartley Dobb Professor for the Study and Prevention of Violence and the co-founder of the Social Development Research Group in the School of Social Work at the University of Washington. He has led research and program development to promote positive youth development and prevent problem behavior. He is the co-developer of the social development model, several parenting programs, and the community prevention approach, CTC. Dr. Lisa Saldana will present on her work on the stages of implementation model within child welfare that is being implemented at scale in over 40 counties in California and Ohio, including lessons learned and current needs to sustain quality implementation. Dr. Saldana is a senior research scientist at Oregon Social Learning Center. She is currently the PI on the stages of implementation completion for evidence-based practice and NIMH grant, examining the successful implementation of interventions in community settings. Dr. Marion Forgatch, who is here virtually, we'll talk about the train the trainer model and need for ongoing fidelity monitoring, drawing from her work with the Fidelity of Implementation Measurement FIMP tool used at the country and state level. She will present on specific recommendations for next steps needed for monitoring fidelity when implementing programs at scale in real-world settings. She is Senior Scientist Emerita at the Oregon Social Learning Center, where she developed and tested programs for families with children at risk or referred for child adjustment problems or substance abuse. She and her team conduct large-scale implementation for systems providing services to families in child mental health and child welfare. Dr. Carlos Gallo will present on the need for efficient measures of implementation fidelity, drawing from his work using qualitative and computational linguistic methods. He is currently a research assistant professor at the Department of Psychiatry and Behavioral Sciences at Northwestern University. Dr. Gallo applies his expertise in bilingualism and natural language processing to developing computational methods for measuring fidelity and parent training prevention interventions. Thank you. We'll start with Rico.